Center Test Prep Exam Cengage. Question 1. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A. Insert a urinary catheter immediately. Option B. Perform a retrograde urethrogram before catheter insertion. Option C. Irrigate the bladder with normal saline. Option D. Prepare for suprapubic catheter. The correct answer is option B. Perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 2. A patient leaving against medical advice, AMA, must be informed of: Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 3. What is the priority intervention for a patient with an open fracture? Option A. Immediate surgical debridement. Option B. To apply traction. Option C. Cover the wound with a sterile saline moistened dressing and immobilize. Option D. Administer analgesics. The correct answer is option C. Cover the wound with a sterile saline moistened dressing and immobilize. In the emergency department, the initial management of an open fracture includes covering the wound with sterile, moist dressings to prevent further contamination and desiccation, and immobilization of the limb. Question 4. Which assessment finding is consistent with a flail chest? Option A. Crepitus over the sternum. Option B. Paradoxical chest wall movement. Option C. Trickle deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Paradoxical chest wall movement. Flail chest occurs when two or more adjacent ribs are fractured in multiple places, creating a free-floating segment. The segment moves paradoxically, inward during inspiration, outward during expiration. Question 5. Hepatitis is primarily transmitted via: Option A. Blood and body fluids. Option B. Fecal-oral route. Option C. Sexual contact. Option D. Contaminated needles. The correct answer is option B. Fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 6. CEN Blakemore tube placement is used as a temporizing measure for bleeding from: Option A. Peptic ulcer. Option B. Esophageal varices. Option C. Diverticulosis. Option D. Aortoenteric fistula. The correct answer is option B. Esophageal varices. A CEN Blakemore tube is a balloon tamponade device used to apply direct pressure to bleeding esophageal or gastric varices when other measures fail. It is a temporizing measure until definitive treatment. Question 7. A female patient of childbearing age with abdominal pain should always be evaluated for: Option A. Ovarian cysts. Option B. Pregnancy status. Option C. Endometriosis. Option D. PID. The correct answer is option B. Pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out life-threatening ectopic pregnancy before other diagnoses are considered. Question 8. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A. Left anterior descending artery. Option B. Left circumflex artery. Option C. Right coronary artery. Option D. Left main coronary artery. The correct answer is option C. Right coronary artery. ST elevation in leads 2, 3, and AVF indicates an inferior wall myocardial infarction. The right coronary artery, RCA, typically supplies the inferior wall of the left ventricle in the majority of patients. Question 9. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects: option A, cystitis; option B, pyelonephritis; option C, nephrolithiasis; option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Pyelonephritis is an upper urinary tract infection characterized by systemic symptoms, fever, chills, and CVA tenderness, distinguishing it from lower tract cystitis. Question 10. The antidote for benzodiazepine overdose is: option F, naloxone; option B, flumazenil; option C, denacetylcysteine; option D, datropine. The correct answer is option B, flumazenil. Flumazenil is a competitive benzodiazepine receptor antagonist. However, its use must be approached with caution, especially with unknown ingestions or chronic users, due to risk of seizures. Question 11. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: option A, forcing oral fluids; option B, straining all urine; option C, pain management; option D, surgical consultation. The correct answer is option C, pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 12. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis; option B, right ventricular failure; option C, left ventricular hypertrophy; option D, atelectasis. The correct answer is option B, right ventricular failure. A massive pulmonary embolism increases pulmonary vascular resistance, which can cause acute right ventricular strain and failure, acute cor pulmonale, due to the increased afterload on the right ventricle. Question 13. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius, 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter; option B, prolonged QT interval; option C, Osborne, J, wave; option D, ST depression. The correct answer is option C, Osborne, J, wave. The Osborne or J wave, a positive deflection at the J point, is a characteristic ECG finding in moderate to severe hypothermia and becomes more pronounced as temperature decreases. Question 14. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly; option B, report the observation to the charge nurse or manager immediately; option C, document the observation in the patient's chart; option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. The nurse has an ethical and legal duty to report suspected impairment or diversion to the appropriate supervisor immediately. Confrontation can escalate the situation and compromise the investigation. Question 15. The golden hour for acute ischemic stroke refers to the window for: option A, completion of an MRI; option B, administration of 4 thrombolytics, TPA; option C, achievement of blood pressure control; option D, initiation of physical therapy. The correct answer is option B, administration of 4 thrombolytics, TPA. The golden hour in stroke care refers to the critical importance of rapid assessment and treatment. For TPA is generally indicated within 3-4.5 hours of symptom onset in eligible patients. Question 16. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates: option A, allergic rhinitis; option B, nasal mucosal secretions; option C, CSF leak, rhinorrhea; option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. The presence of glucose in clear nasal drainage after head trauma confirms a CSF leak because CSF contains glucose, while normal nasal secretions do not. This is associated with a dural tear. Question 17. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects. Option of open-angle glaucoma. Option B, acute angle closure glaucoma. Option C, conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle closure glaucoma. The presentation is classic for acute angle closure glaucoma, an ophthalmologic emergency. The sudden rise in intraocular pressure causes eye pain, cloudy, steamy cornea, a fixed mid-dilated pupil, and requires immediate treatment. Question 18. To calculate cerebral perfusion pressure, CPP, the nurse needs to know. Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D, central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. CPP equals MAP ICP. A normal CPP is 60 to 80 mm/Hg. Maintaining adequate CPP is critical to ensure cerebral blood flow in patients with elevated ICP. Question 19. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, trickle deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray. Option B, needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 20. Fat embolism syndrome is most commonly associated with fractures of the option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Fat embolism syndrome occurs when fat globules from bone marrow enter the circulation, most commonly after fractures of long bones, femur, or pelvic fractures, causing respiratory distress, petechiae, and CNS changes. Question 21. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. The presentation suggests a possible ruptured ectopic pregnancy, which is a life-threatening emergency. A pregnancy test is the critical first step. An IUD increases the risk of ectopic pregnancy if conception occurs. Question 22. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, a unilaterally dilated and fixed pupil. Option C, bilateral mid-position and fixed pupils. Option D, constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. As the uncus hernates through the tentorial notch, it compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed, blown pupil. Question 23. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should option A, stop the nitroglycerin infusion immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option C, treat the headache and continue nitroglycerin as ordered. Headache is a common and expected side effect of nitrates due to vasodilation of cerebral arteries. It is not an indication to discontinue therapy. Analgesics can be given while continuing the nitroglycerin. Question 24. Murphy's sign is used to assess for option A, pancreatitis. Option B, acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B, acute cholecystitis. Murphy's sign is elicited by palpating the right upper quadrant during inspiration. If the patient experiences sharp pain and abruptly stops inhaling, it suggests acute cholecystitis. Question 25. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option of acute glaucoma. Option B, retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. The patient's description of a curtain being pulled down or a shade being drawn over their vision is the hallmark symptom of retinal detachment.